Huh. Ah! I can hear you, I think. You
I
hear me?
went I went
Oh,
to my phone,
oh, okay. Okay.
iPad.
No, sometimes it's just so weird like that. I don't know why, but
Well,
okay.
we needed a 20-year-old in here with us.
Yes, I know, right? Yeah, that just wasn't happening. All right, cool. All right, good, good, good. So how are you?
I'm good. How are
Good.
you?
How's the beach?
It is lovely. We have 75 degrees. I walked with dolphins today because they were swimming along the beach.
That is so cool.
Yeah,
Very
the
nice.
best.
Very nice. Okay. Well, thank you for coming on. I know this is difficult for us technologically challenged people to do
There
this.
may be two videos of us out there going.
No, I deleted them. And I think everyone who's like joined is probably like, why? This is like the fourth time you have come on and then hung up and then come on again and hung up. So yeah, okay, good time. All right. Well, thank you for coming on, Sandy. I appreciate it. And so we're going to talk today about NeoGen and what you had done and what you think about it. So let's see. You had it about 6 months ago?
I think a little farther back than that. It hasn't been a year. It has not been a year yet.
Mm-mm. No. And so why did you decide that you wanted to do NeoGen?
Well, and I think every person has their journey. My journey, of course, started in Florida with super pale skin before sunscreen was invented. So the belief back then was your parents would take you to the beach or outside to let you get burnt at the beginning of the season, and then that would build your base coat up. And that was pretty much our sun protection at that time, was a blistering burn.
Mm.
But it wasn't just the skin part of it that kind of brought me to NeoGen. The other part of, I think, my journey that's pertinent here is I was a military brat and then a military spouse. And brat's not a bad term in the military. It just means that your parents were military. So I had this entire lifetime history of my medical care never being with the same person twice. It's kind of a doc in the box concept. You go to a hospital, you sit in a waiting room till it's your turn. Sometimes, you have an actual primary care provider, but they may get deployed. You may leave to another post. So it was a constant stream of new doctors and new medical information.
You would bring
So,
your records with you, right?
oh yeah, like
Like the big.
you get, at first you trust that they're going to send them, but they don't. So you start getting copies of them or just taking them at your last visit. And because you would carry your records too, you'd have to go check out your record, carry it. And sometimes I just take it with me. Don't tell the military. They don't know. So yeah, so there were some things that were lost. So, and then you also, the third part of this is, you grow up and you have a little time to think of yourself, and then all of a sudden you're married and you're raising a family, and that time gets less. We moved 20 times. So, that's 20 times finding new schools, new dentists, new doctors, new jobs. So I really didn't have a lot of time for me until my children grew up, as they do. The husband retired out of the military, and I said, it's going to be time for me. So all that converged with moving to Hickory in Catawba County. I don't know if you know this, Dr. Gonzalez, but I picked you. And I picked you by first finding out if you worked with the insurance that we had at the time.
Mm-hmm.
And then I read reviews. I looked at your ratings. I called and they said, well, yes, she's here, but she has a 9-month wait. I said, I'll wait. And I did.
Didn't know that.
Yeah,
Okay.
I waited 9 months. I hadn't met you. I didn't know anybody in the county but I liked what I read and I knew at the first visit. So kind of the third part of that was, when you did your transformation to your new style of medicine, there was no way you weren't getting me. Even if you were like, oh, Sandy, you're sorry, you were 251. I would have waited. I'd have been like, I'll wait. So it was, coming to that point in my life where I was ready to focus on me, finding a place I felt comfortable to wait on me, and the fact that I had craptastic skin from my childhood all converged at the same time. And after looking at the options, NeoGen seemed like the best route for me to take.
Mm-hmm. So what did you look at before? And what were the other things?
Well, I'm not super versed in everything. So of course, the first thing about, you're like, well, Botox. And I was like, oh, you hear good stories, you hear bad stories. You hear that, yes, there's wrinkle reduction. It's a continual thing that you must keep up with. Then you hear the horror stories about things. Not that it's a bad process, but you just have to be kind of careful with it. I looked into a kind of filler that I can't remember the name of. I went to the night that y'all had the open house for the, I'm going to say it wrong,
Lotus. Yep.
the Lotus.
Mm-hmm.
And I kind of, looked at that, but by then I was already really sold on NeoGen. I was just coming to tell y'all I was doing NeoGen that night, even though you weren't focused on it.
Okay, cool.
Yeah.
We'll take it. So what was it, as far as your face that you wanted to focus on? What were you concerned about?
Well, lots of it, but not in a horrible way. Like, I don't consider myself a super vain person, but the other thing that kind of converged at the time was I started the weight loss medicine, and I lost a lot of weight. The joke is Ozempic face, but mine was Mounjaro face. So I had a few things going on at the same time. I had lost some weight and just natural aging, the wrinkles, the sun damage kind of came to place. I had really dark creases across the top of my forehead. And okay, if anybody's listening, don't think, I'm going to get bangs and cover that if you don't know you can have bangs, because I can't have bangs, apparently. Not a good look. So I couldn't do that and cover it. And then when I catch myself smiling from the side, I would get steps up. So there were just things that I thought, well, I didn't expect to do it and look 20 years younger. Had to manage expectations, but I thought, you know what? Sometimes it's just a little bit. It's a little bit at a time that kind of makes things different. And then I was hoping for some help here. Now, anybody who's watching this, you're going, oh, but you still have dark puffy circles. Not like I used to. Actually, it kind of helped that area a bunch. You can pick out members from my family anywhere in the world by going, they're related to her, because we all have dark, very puffy eyes. And I mean, there's not a percentage I can give you, but I could probably say at least took care of half of what was going on there. So I was just hoping for everything.
Well, we do have some pictures of before of you somewhere, like on the page somewhere. And I think that the follow-up, it was maybe a 3-month. I don't think we've done one in a while. So the next time I see you, we'll do it.
Yeah.
Yeah. But yeah, you can definitely see an improvement. It's on, obviously, but it's better.
The first improvement was here. I remember that thinking, oh, okay. I mean, I still smile, so there's still, room to smile there. And then the forehead. I remember one day, and it was somebody at work who just looked at me and said, man, your forehead looks good. And I thought, well, that's a strange compliment, but I'll take it. And then about 6 weeks ago, I met my daughter for a pedicure. And she said, Mom, your cheeks. And I thought that I messed up putting on blush because sometimes with light skin, it's tricky, you know? So I said, oh, no, let me fix it. And she said, no, it's that you have cheekbones. And I had to go home and look, you know, it's like, oh, I have cheekbones. And, you know, that was the result of NeoGen. They were more like that before, blowfishes.
Oh. Well, the nice thing too about it is it does help with the volume, but also the skin tightening. And so one thing when I looked at your pictures, especially those 3-month ones that I was talking about that are on the page, is right here. You really got kind of tightening here.
Yeah.
And, you know, you had like a slimming effect on your face. So,
yeah.
And that was one thing that I really noticed, because a lot of times when women, especially, I mean men too, but when they get older, you know, they get more of like a squaring off of the jawline just because of jowling. But yeah, that actually really, you got a lot of collagen here and a lot of skin tightening. And so it's more of a, they call it a, like upside down triangle or heart shape.
And I forgot about that. My jaw's a little offset from TMJ. And so this side had a pretty big wumple. I don't know the official name of it, but we'll say wumple right here. And it's all but gone. And if I'm taking a picture and I'm just conscious for a second, you don't even see it anymore. And that was something that every time I looked in the mirror, I was seeing. Now, if you ask somebody, they go, no, it's fine. But I know they saw it.
Well, we're always our worst critics. So, yeah. But yeah, definitely you've had improvement. And the thing about NeoGen that's really neat is you have to be patient, but it does eventually, you see the improvements. And particularly with the high energy, which I think you had, did you have a full high or a combination? I can't.
Combination.
Yeah, the combination. So the combination is low over the whole face. And then we did high energy here, you know, kind of the triangle. And as I went to Boston for that training with Sean Charles, who does all, you know, if you've ever seen his Instagram page for NeoGen, they've got hundreds of pictures. But anyway, so he did the training and he was so funny. He said, I call this the triangle of death.
Okay.
But yeah, because everyone's
calm
like,
down, Sean.
He was great. He was great. Very sweet. But yeah, definitely, you know, you focus the high energy here, and the high energy will continue to help with building collagen for like 12 to 18 months. I mean, they've done biopsies and looked at it. So it really does last a long time. And so that's like what your daughter was seeing, just the continued effects.
Well, and that's truly a cool thing about it, because, you know, I kind of like people I worked with, they knew I was doing it because, you know, I'm like, oh, I won't be in next week, because afterwards your face doesn't peel off, but there's peeling on your face. It's not big sheets. It's just a little, it's not, but I didn't want it to go. I work with young children and I wasn't going to scare them. So when I came back, you know, they were all like, oh, let me see your face. I'm like, oh, no, it's not like that. They did say it, you know, at the beginning, but it has been this almost very gradual, very noticeable. But I think that's kind of better, because it nobody's remembering yesterday to today. They're just like, oh. I think what I hear the most now is, which I used to not hear at all, is your skin looks great.
That's awesome.
Yeah,
it really does. Yeah.
No filter.
So
there's no filter on.
Yeah. Now, one thing that actually, since you had yours done, is we've learned a new technique. We're using this gel, which it makes it much more comfortable, and you really actually don't need a lot of numbing. If we're going to do really, really high, I'd probably still numb a little bit. But if it's a low energy or kind of a lower high energy, you don't need the numbing. And then your face, the skin is still pretty hydrated. That same kind of, you know, afterwards you probably noticed it was like very pink and then kind of darker pink and then kind of brown and then you peel. It's not like that now. And your recovery is much faster. So I'm sorry we didn't have it when you did it.
Thanks, Dr. G.
It's pretty new. So if you want to have it again, we'll do it that way.
Well, and the recovery when I had it wasn't bad. other than she'll require you to wear dumb hats when you go on vacation. Uh, so, you do have to protect your new baby skin from the sun. But other than that, it really, so you wear a hat, yes. And I was about to say, and I got much better about wearing sunscreen. The sample you gave me, I ended up just continually getting that one. It's the Elta with the tint to it. Yeah, it just gives you, it doesn't really color your skin. It just doesn't show on your skin. And it's kind of nice.
It just kind of smooths everything out.
Yeah. And I think it's moisturizing too.
It is.
And I also continued to use the Elta moisture barrier just as a moisturizer because it was amazing. It very hydrated, I feel. And
now that we're heading into winter, it's perfect for that. Yeah. So during the procedure, did you have any pain?
Okay, so doctors hate when I ask this question because I go, what's your pain scale? Does it stop at childbirth or? So we compare it to childbirth. No, there was no pain. And I remember you told me it's like a rubber band, but it really wasn't even a rubber band. It was just more like just a little, a zap. And you feel it, but no, it wasn't extreme.
Yeah.
It wasn't. I'm a wimp, so I don't think at once. I think one time I said, "Ooh, give me just a second," and I just kind of had to deep breathe in, deep breathe out, and we were ready again. But there was nothing harsh about it, nothing scary. Sometimes the sound, you hear that sound, and you're like, "Oh, it's about to go again. Oh, it's about to go again." But yeah. Sometimes it scares, like just not scared, but surprises people. So I always try to say, "Okay, we're about to start." You zapped it a few times so I could hear it beforehand, so I wouldn't hear it first on my skin. But no, it really, as far as having your face zapped, it was actually pretty relaxing, which kind of goes back to that, you being my doctor, me tracking you down for months. It was already a comfortable thing. I came to your office. It's, because this procedure was going on, I didn't even sit in a waiting room or anything. It was like, hey, come on back. And it was very calm and comfortable. There wasn't a lengthy procedure when I walked in there and filling stuff out, or it was just ready to go. And it was very relaxing. So it's relaxing as you can be, having your face zapped 750 times. I don't know how many times. That might be too many. I don't know. I don't know for sure. It was more. Oh. See, I didn't even know.
You lost count.
Yeah.
Oh, man.
Not consciousness. No. Count. Just count.
Yeah. So, now that you are 6+ months out, do you feel like the NeoGen helps you reach your goals? Are you happy with what you've got?
I am. I'm kind of exploring now, thinking, okay, well, we made some eye progress. I wouldn't mind knowing what it's like not to have bags under your eyes. And I'm not going to do this, but I could pull you up pictures of me as a 2-year-old. You'd be like, oh my gosh, you're the only 2-year-old I know with bags. They are a lifetime thing. So it would be nice to know what smooth skin feels like under eyes. And this is totally my fault. I work as the regulatory person at an agency, so all day long I'm reading notes and I'm thinking, what the? So I still have what this. These are my what this. I go, what the? I know that's not the medical term for them, but I would think that this might be an area.
Yeah, I have some teachers who have those, and that's kind of what we call them. What were you thinking?
Yeah. What were you thinking? Anybody that works with me, I'm not talking about your stuff, somebody else's.
Yeah. So yeah, those we can work on those. We can work on those. So okay. So then, what was your favorite result with? Because there are a lot of different things. Skin, the volumizing, kind of shape your face. What do you think? Eyes.
It's hard to say because it all came together. And I mean, it's almost like, so before, and I remember my mom telling me this when it happened to her. She goes, I looked in the mirror and there was an old lady there I didn't know. And I was like, oh, Mom, it's because you're old. That came back to bite me, didn't it? We laughed. Okay, I laughed. She looked at me. But it had gotten to that point where I looked in a mirror and I was like, oh, because in my head, I'm not that age. And I don't feel like in my body I'm the age that I really am. So it was kind of that slow process of getting some of that back. So, before I'd look in the mirror and I'd go, oh, okay. Now I look in the mirror and I go, oh, well, hold on, let me, and I don't look right to here, or I don't look right to here. I just feel a little more me.
Yeah.
If that makes sense.
Excellent. So you feel a little more comfortable in your own skin.
Exactly. Yes.
Good. Well, that's great. That's wonderful. Well, I'm glad.
Thank you.
So, would you recommend this procedure, NeoGen?
Oh, absolutely. Absolutely. Like I said, it was, I mean, and I'm whiny. I'm a little whiny about things. And I did this on a weekend my husband was going to be away, because I knew that I would just be whiny and be like, can you get me a drink? And there would be no reason for that. It's really not that intense. And it really wasn't bad at all. That day, the exact day that I had it, I put on a hat and got my dog and went on a walk around the neighborhood. It really, there wasn't a lot of recovery. Yes, you do have the flaking and you're watching to make sure. One thing I remember we did was I sent you a picture every morning till you said, no, seriously, I don't need these anymore. So that you can monitor it, without having to have a visit. But it wasn't extreme. Like I did not feel like even right after it that I couldn't have walked into a grocery store. I think somebody would have just said, oh, she got a sunburn maybe or something. It wasn't a lot of pain. I remember you gave me a little tiny jar of, gosh, I don't remember what it was called, but you said, I don't think you'll need this, but if it feels a little stinging or burning, you can put some on. I had not opened that. It's still sitting.
Mm-hmm. Yeah, it's that little gel. And of course, the name is escaping me, but yeah.
Me too. Yeah.
One of those things. So, the cool thing about NeoGen, and one of the women, she's up in Cape Cod, she has a NeoGen and she always advertises hers as the time machine. And so it really does. It kind of, brings your skin back several years.
Yeah.
Bad thing is it doesn't stay like that. You still continue your aging process. So, some people will have it done again.
Yeah.
Year and a half, 2 years later, depending on what, how their skin was at the beginning. So people who have lost wrinkles, usually older than you, but they may need a second treatment in 6 months, and then they're really seeing big improvements. So it's kind of, sometimes you need one treatment to kind of get the skin kind of prepped and going, and then the next one really kind of ramps everything up. But whenever you're ready, again.
Yeah, I honestly had thought about that. I had kind of, put on my my mental calendar, which I probably should write it down on a real calendar. That, in fact, my husband was even like, well, tell me about it. What was it again? Because he wasn't here when it happened. I can't see doing it again because it was a few, a couple hours. I don't think it took a couple hours. It was the numbing and then, just a little bit of time, but like a couple hours out of my day, a few days avoiding some people, and then the healing started, and the results just keep coming. Like I said, it wasn't that long ago. My daughter was like, Mom, your cheeks. And I was like, oh my gosh, I have cheeks. Look at that. I have cheeks.
Yeah. Yeah. And with the new technique, it's not, time to do it is actually, because we're not doing lengthy numbing. Like we would numb people for 30 to 45 minutes just to make sure it's comfortable.
Yeah.
You need that, the second time. So Was there anything else you want to say about NeoGen that you hadn't already told us?
I mean, I don't think so. I kind of thought about it, our conversation, and I just really feel like it was a good experience, and it was a new experience for me. I'm not that person, I'm nature girl, and if I spend a lot of time out in the woods, and I'm at the beach, and I'm walking the beach in the morning looking for little sea animals. I saved 9 worms yesterday off of the sidewalk. I'm not somebody who really ever has been super fussy or super into a lot of things when it came to aging, but of course I had younger skin then. And it was a very nice step into the process. It was a very nice way for me to say, hold on, to me, for years, I was using stuff on my skin. The only thing I knew that it wasn't tested on animals, because that was important to me. But the more I've learned, and the more I look back, and that I see that I was putting all these chemicals on my skin that, over time have been proven were not wonderful. And here was something that I could do in a short amount of time with long-lasting results that still meets my standards of being ethical. Like, no muskrats were hurt in me getting NeoGen. There was there was nothing that was dangerous to me or to something that I care about. So yeah, I definitely would recommend it. I would definitely do it again, though I don't know if everyone needs to know that was my secret, but
It's out now.
Yeah, too late. Too late.
Well, I did not in the past. I've not thought about it in that sense that it's a very ethical treatment. No animal testing, no animals are harmed in the treatment. So, yeah, that's a great point. I'd never thought about it, but it is. And then you mentioned so that because it's not harming anything else, it is your own body's collagen. You're stimulating your own body to produce more collagen. So that's great. You're not putting any, foreign substances in, and it's just all you.
With a little help.
With help, yes. All right. Well, I think that's all we wanted to talk about today. So thank you so much for sharing your experience. I really appreciate you, and I appreciate you as a patient. I didn't know that you had stalked me before.
I had no doctor for 9 months. I had to stay healthy in case. I even asked them that. I said, what if I get sick before the 9 months?
Yeah. Well,
I waited.
I appreciate you so much.
Well, thank you. I appreciate you.
Enjoy the rest of your vacations. And I think I'm supposed to see you in a couple months, sometime soon.
First week of December, I believe.
Awesome.
All right.
I will see you.
All right. Bye.
Thank you so much. I appreciate it.